Thanks for the introduction. So I have nothing to disclose. The ice water test was first described in 1957 by Bors and Blin to differentiate between lower and upper motor neuron lesions. The ice water test is the same as the presence of a bladder coding reflex. It's present in normal neurological children below the age of 4 years old. Afterwards, it's becoming suppressed by increasing upper motor neuron inhibition. In patients with upper motor neuron lesions, the reflex reappears. So the aims of our study, we wanted to know exactly when the presence of the bladder coding reflex is present and more interested in idiopathic overactive bladder syndrome. As our second aim, we aim to investigate if there's an association between the presence of the bladder cooling reflex and the response to anticholinergics in idiopathic overactive bladder patients. In this case, we also want to know if there's an association between the severity of urgency frequency symptoms and the result of these bladder cooling reflex. So we did a prospective cohort study, and we included patient populations with neurogenic detrusor overactivity as our positive control group, stress urinary incontinence as our negative control group, and our study group with idiopathic overactive bladder symptoms. We did a standard urodynamic study, and afterwards we performed the ice water test by instillation of 60 milliliter ice called saline for 1 minute into the bladder. When we saw detrusor contraction of more than 50 centimeter waters, it was remained as positive. Otherwise, we repeated the ice water test up to 3 times. Afterwards, we asked all patients to fill in our validated urogenital distress inventory questionnaire. So what we saw, we included 62 patients between 20 and 85 years old. We saw in neurogenic detrusor overactivity that all patients showed a bladder cooling reflex. In our study population, 38% or 13 patients out of 34 patients showed a bladder cooling reflex. We aim to investigate the relationship between the response to anticholinergics and bladder cooling reflex. We could assess this in 20 patients because 20 patients not took any anticholinergics at the moment of the ice water test. And as you can see, 7 out of 8 patients with the bladder cooling reflex showed non-response or resistance to anticholinergic treatment, in contrast to only 2 patients with no bladder cooling reflex that showed no improvement on symptoms to anticholinergic treatment. And our second aim, so the severity of urgency and frequency symptoms, could assist in 32 patients because 2 patients didn't fill out our UD6 questionnaire. When we divided this population in 2 subgroups with severe and mild urgency based on the UD6 questionnaire, we could see that a lot of patients with severe urgency showed a bladder cooling reflex, in contrast to only 5 patients with severe urgency showed no bladder cooling reflex. So in conclusion, when we have a patient with idiopathic overactive bladder symptoms and a positive ice water test or a bladder cooling reflex is present, they had more complaints of urgency and frequency and more chance to be resistant or non-responders to anticholinergic treatment. In this subgroup of patients, there might be another pathophysiology that need another treatment strategy. So maybe it's better to give them more invasive treatment like Botox injections or neuromodulation. Our study is empowered because of the limited included patients number. So prospective studies with larger number of patients with EOAB would be needed to determine if these findings can be validated to be significant. So thanks for your attention. Are there any questions?
Martin?
Yeah, Martin Michel, Johannes Gutenberg University. Very interesting. The one thing on your final slide that is puzzling me somewhat, we know from the analysis of several big databases that the greater your urgency and frequency are pre-treatment, the bigger is your at least absolute response to an anticholinergic. And you say in this group identified by the water test, it actually turns into resistance, which may indicate that what you're seeing is even an underestimation. The problem may even be bigger because you would expect that, if anything, those with a lot of symptoms have a stronger change than the others.
Yeah, indeed, that's another thing. So we we showed resistance or non-responded as that they had no improvement of symptoms on a diary, so for 3 days, and at least we used or tried to use 2 anticholinetics for at least 6 months when they didn't have too many side effects like dry mouth or blurred vision or tachycardia or something. Thank you for your question.
Can I ask a question? Do the patients report any discomfort or pain during the ice water test?
Yeah, they had some they had discomfort, but they didn't have any pain during this test. No. Thank you.
Was the relative resistance to all antimuscarinics, or did you use one in particular?
No, we used different, but not mirabegron. So mirabegron was not in the anticholinetics. So with the more invasive treatment, we maybe can also use a combination treatment.
So, do you think maybe it was a different peripheral neurotransmitter that was responsible for the overactivity in those patients that were not responsive to the ice water test? In other words, is the peripheral transmitter different for neurogenic because it was 100% positive than idiopathic overactive bladder?
So what we know is that maybe the purinergic transmission is also important, and with the idiopathic overactivity, some maybe a subgroup, because we don't know yet, maybe a subgroup they have more transient receptors, so the TRP channels, that maybe are more in a subgroup of the idiopathic overactive bladder symptoms than in the other patients.
Martin, you must know that. What do you think?
Martin, Michelle.
Sorry, I was just not...
What? I was going to say, wait a minute, he changed his name now. In other words, you think it may be a different neurotransmitter or not?
I have a hard time imagining that. For one reason, I don't think the acetylcholine as a neurotransmitter is very important in the storage phase. Rather, it's non-neuronal. What we do know that in pathology, so in contrast to most animals, in the human bladder, healthy, it's more or less only acetylcholine, whereas in all the animals, it's purinergic and everything else. And this component only kicks in pathology in humans. So maybe the relative role of that goes up so much, and that causes a relative unimportance of the cholinergic pathway.
Thank you very much.
Thank you.